Well, thank you all for being here. It's just a real thrill for me to see you, and I hope if you haven't been to the Gaslamp Museum before, we'll convince you that you should come back. You're actually in the midst of our exhibit on Alonzo Horton. This is his 150th anniversary of his arrival here in San Diego, and I can tell you through our research we have answered that question. Yes, he had 5 wives. So anyone who knows me as the executive director might be wondering what I know about early medical care in San Diego. And anybody who knows me as a pediatrician might be wondering what I know about early medical care in San Diego, because we all know how much we learned about the history of medicine, which is about that much. But in my time here at the museum, I've been very impressed with how the development of medical care paralleled what happened in the gas lamp, and so that those interests have kind of come together to develop this idea of what actually was going on in medicine here in San Diego from about the early 1800s to about 1900. So in my studies, what I've determined is, as we all know about San Diego, there's 2 factors that probably were most important. One was the climate, one of the reasons we're all here. The climate in San Diego has been touted all over the nation for literally hundreds of years as being very healthy. So that was one factor. And the other factor is that it's sort of the end of the trail. It's the end of the trail by boat. So if you went all the way around the Horn and came back, you finally got here, you landed in San Diego. It was the end of the trail by boot. You may have come across on a wagon, on a horse, on a mule. You may have come down a raft. However you did it, very few people ended up in San Diego by accident. So with that, we're going to talk about the first doctors in San Diego. So the first doctors in San Diego were in Old Town, and they were actually army surgeons. And the missions themselves had essentially no medical equipment. They had no training. They had some folk medicine. But when the Padres marched up the coast, they didn't bring a lot of medical training with them. There was an exception, and this is one of those stories in history that you literally can't make up. There was a gentleman called James Ohio Patty, and his father, Sandy, come on in. He and his father were fur trappers, and they were fur trappers in Colorado. They had a terrible winter. They ended up deciding they had to get out. They got on the river, they floated down, they ended up in Mexico. In Mexico, they decided they better get out of Mexico. They walked up the coast and landed in San Diego, whereupon they were arrested as spies. They were jailed in the Presidio, and they were accused of spying for Spain because the Mexicans here were very suspicious of the Spaniards. At the same time, there was a smallpox outbreak in Northern California. So James Patty, his father actually had died in the Presidio. He went to the governor, whose name was Governor Achandia, and he told him that he happened to have a small amount of smallpox vaccine. And he was willing to vaccinate people if he would be set free. And the governor fell for that. He let him out of jail. He, of course, vaccinated everybody around them. Then he started vaccinating all the people that were in the missions. By the time he got done, he said he gave 20,000 vaccines. Well, number one, I have no idea how he got the smallpox vaccine. Why would this fur trapper from Colorado have smallpox vaccine? And there weren't 20,000 people here to vaccinate. But he is down in history as having given the first smallpox vaccines in San Diego. So the next people who came into town were army surgeons. And whenever there was an army regiment here, they would be assigned to the Presidio, and the surgeons would see local people, and the Indians and the local people were happy to see them. But they didn't have much equipment, they didn't have many supplies, and when they left, there were no services. So in the 20 years prior to the Mexican War, to the end of the Mexican War in 1848, there were no medical services here at all. Well, in 1846, Commodore Stockton sailed into the bay with 3 ships. He had surgeons on all these ships, and he actually sent those surgeons into Old Town, and they actually started operating on people and seeing the locals for the medical care that they were able to provide. So those were actually the first doctors that were here in San Diego. They housed the patients with private families. And that was pretty much the state of it until the first medical doctor arrived. Slide. This is Dr. David Hoffman, and he was employed by the Pacific Steamship Line, and the Pacific Steamship Line went from Panama to San Diego to San Francisco. Notice who they skipped? There was nothing in LA. So, you know, he did that for 2 years. He was out for adventure. So after 2 years, he decided that he wanted to settle in San Diego, and he set up a practice. He was named the county physician, a position that was not hard to get. His initial act was to offer smallpox vaccine to everyone, free if it needed to be, and he actually had smallpox vaccine. And he also was responsible for vaccinating the local Indians. He also organized and was the first president of the San Diego County Medical Society. He was the physician to the county jail. He had 3 tenures as a district attorney. He was the coroner. He was the town trustee. He was on the board of supervisors, and he was a state assemblyman. I personally think he had ADD, but so the next physician was Dr. Edward Burr. He came from Ireland. He came to us via Oakland. He was also a coroner and a county physician, and he kind of went in and out of those positions for several years. So those were the 2 physicians that really were the original physicians in Old Town. Well, the next group of doctors decided that they didn't want to settle in Old Town because it was old, and they wanted to settle in New Town. So this is when Alonzo Horton came to town, which was in 1867. So the first one was Dr. Jacob Allen. He had his residence, his office, and the drugstore all together on the east side of Fifth Avenue. And this was literally just down the block because Fifth Avenue didn't go very far at that point, just ended at the wharf. He was also the first postmaster, and you won't be surprised to know that the post office was in the drugstore. The next physician was Dr. Robert Gregg. He left the East Coast and was coming across the country and developed yellow fever when he was in Texas. Ended up going back, finally was recovered from that, came across the country again, and arrived in San Diego in 1868. And he was an assistant to Dr. Burr in Old Town, but then he decided he wanted to come to New Town too, and he moved in across the street from the drugstore. He was one of the best known physicians in Southern California, but I can tell you that that's not saying much. Slide. The next slide is Dr. Thomas Stockton. He's from New Brunswick, Canada, and he is the nephew of Commodore Stockton. So he'd heard about San Diego. And Commodore Stockton was in charge of the American forces in 1848 when the Mexican War ended. He was basically sent here to make sure that there was no problems at the end of the Mexican War, and basically to take over and move the Mexicans out. He was Harvard trained, and then he went to Bellevue, where he left and moved to San Diego and got here in 1869. He was the coroner, the public administrator, the city health officer, and the county physician. He was also one of the organizers of the San Diego County Medical Society. He was the first person who kept records of anybody who was actually born in San Diego. That wasn't required. There's no state board of health. There's nobody telling you what you have to do these things. So he did that on his own. And he has a very special place at the Davis-Horton House because the San Diego ghost hunters say that his ghost visits us regularly. And if you are in the parlor, there's a black needlepoint chair, and that is his chair. So we're very, very respectful of Dr. Stockton. Slide. So the next slide is Dr. Peter Remondino. And he is probably the most illustrious physician that we had in the first century in San Diego medicine. He was a native of Turin, Italy, and his ancestors were well-known physicians and anatomists. And he could trace his history back to Mondino de Liuzzi in the early 1300s. And Mondino de Liuzzi was the person who reintroduced the study of anatomy, of human anatomy, into a medical curriculum. And up to that time, they had been using Galen's teachings that were based on dissections of animals from the 2nd century. So when they talk about the Dark Ages, they mean the Dark Ages. So anyway, so his family had always been very illustrious. They came to the United States when he was a young boy. He joined the military after he was trained as a surgeon, and in the military he developed malaria and ended up having to leave. So his answer to getting better was to go to France and volunteer in the Franco-Prussian War, where, to no one's surprise, his malaria came back. So he came back to the United States. He wants to recover his health. And where does he come? San Diego. So he got here in 1874. He had an office next to Dr. Gregg, who was his old classmate from Jefferson Medical College. He was a city physician, the county physician, the first president of the Board of Health, a member of the State Board of Health, the chair of the College of Physicians and Surgeons in LA, which became USC. So the chair of the USC Medical School was here in San Diego, which I love. He also was a surgeon for the California Southern Railroad, and that's the first railroad that came to San Diego. And they had a Pullman car, and the Pullman car would go to wherever they needed medical services. So he would take care of patients, and then until the railroad came in and then brought the car, and the car was set up as an infirmary. So I figure that's the first version of Kaiser. He was also the physician for the Marine Hospital and for the Pacific Coast Steamship Company. So I think he meets every definition of an overachiever. Well, Dr. Dino, the next slide, was the author of many articles on public health and sanitation, and he wrote several medical texts, and this is his work, and it is the first comprehensive study of circumcision that was ever done. This is his copy, that's his signature, and it is in the San Diego Public Library, and you can go up there and look at it just like I did last week. You can also get it on Amazon. And there's a series of medical books that have been selected by scholars. So I'm not sure what the distinguishing criteria is. And those books continue to be repeated. And this book is one of that series. And that's why it's continued to be published. So, well, he was here in '74, and he practiced for about 20 years. So it was probably, my answer to everything is the turn of the century. He also had one of the best technical libraries in the world, certainly one of the best in the United States. And he had copies of Mondino de Liuzzi's anatomy books, in addition to medical books and general literature books that he'd collected all over Europe and the United States. He had about 15,000 books in his library. About 3,000 of them were medical books. So his idea was he was going to donate it to the local library. So he took all the books that he had written and he donated them to the San Diego Public Library. One day he goes into the library, and in the discard bin is one of the books that he had donated. Whereupon he retracted his decision to donate it to the San Diego Public Library, and you can see them today at Loma Linda. So that's the library that ended up taking his collection. Next slide. So you can see from this discussion that the doctors were really Juris Doctors. Leland Stanford did probably a classic study of the medical care in San Diego in his article on the medical legal history of San Diego that was in 1970 in the Journal of San Diego History. He estimated that about half the physicians spent about half the time on legal issues. And so if you were the coroner, you could hold an inquest, you could subpoena witnesses, you questioned them, and then you issued the arrest warrant if you decide if that's what the decision was. The public administrator would handle probates. Even though that doesn't necessarily have a direct medical connotation, these were educated professional men in a small town that needed those kinds of services. So they really ended up serving a great public function. And he said they could cut muster in the courtroom as well as in the sick room. So I think that gives you an idea what it was like to be an early doctor. I'm going to take my prerogative and talk about one more physician, and nobody's going to be surprised that it's Dr. Charlotte Baker. She comes a little bit later, but she was the first woman physician in San Diego. She went to Vassar after a teaching. She taught for a while and then went to Vassar. Then she went to the University of Michigan and graduated in 1881. She actually studied optics and ophthalmology there. Then she went back to her hometown and she married Dr. Fred Baker, and they always practiced together. So first they went to Akron, and then they got smart. That was for Gary. And then they went to New Mexico. They had their 2 children, and then finally they decided to come to San Diego. So in 1888, they settled in Point Loma. And it happened that where they settled, there really were no other houses. I've seen a picture of her house. I mean, it was literally just by itself. So they used to sail to work. And she would say it could take 20 minutes or it could take 5 hours. So their office hours were from 11 to 3, which really doesn't, that sounds really good. That sounds really good. However, people would not take off work to go to the doctor. That just wasn't something that you did. So they would work many after hours and many Sundays, but they were very beloved in town. She was the first woman to be president of the San Diego County Medical Society. And Dave Priver, how long do you think it took before there was another woman president of the Medical Society?
About 100 years.
90 years. 90 years. So there's a fabulous article on the medical profession in San Diego in the Journal of San Diego History. They talked about all the pioneers, and then they talked about the next set of doctors that came. And there's a picture of 4 more doctors, including Dr. Fred Baker. And they did manage to list her that she actually was here in town, but no picture and no mention of the fact that she was the first physician. Well, she wasn't just a doctor. She was also a noted suffragette. She worked to eliminate prostitution. She advocated for shorter work hours for laborers. She was the president of the Women's Christian Temperance Union, and she founded the YWCA here in San Diego. So her motto was, if I had my life to live over, I would not alter my course except to fight harder. So I think she deserves to be in the group of pioneer San Diego physicians. All right, so for a little break, we're going to learn a little bit about what you can do to take care of yourself via 1885. So if you've got a paper and pencil, you might want to take some notes. So here's the recipe for a salve for wounds. So once you've got your hog's lard and your white lead and your red lead, I have no idea between the two leads, and your beeswax.
One is red.
Yeah. and your black resin, and then your turpentine, which I think is the key ingredient here. And you boil for 3/4 of an hour, and then you put in the turpentine right before it's done, and then you just give it a little gentle boil. And it's excellent for all kinds of wounds. So I can see we're just going to all race home and really try to put that to work. All right. So let's talk about hospitals. So when you talk about early hospitals, you're talking about hospitals and poorhouses. And they come hand in hand. So we're talking about physician-supervised care that's outside of a home setting. Well, this kind of care was not provided out of the goodness of the hearts of the boards of supervisors. Things have not changed at all. Basically, there was a law in 1852 from the state that said you had to take care of jailed patients and you had to take care of the indigent. And they had a fund, and there were 3 hospitals. They were all in Northern California, and you should send your patients there. That was the law. Well, clearly, that's not a very practical solution in San Diego. So about 3 years after that, they took the fund and they divided it up among the counties, and so the county got funds that they could spend on indigent patients. So the first jail, the first hospital is this jail, and this is a picture of it when it's sort of run down, but I don't think it looked a whole lot better when it was in a better state. So this was in Old Town, and Sheriff Harazi, Sandy? No? Something like that. That's as close as I can come. Built this jail, and then he was stuck with these patients. They kept getting sick, and if you were poor and you caused problems or they just didn't know what else to do with you, they basically put you in jail. And things haven't changed a whole lot. You have to say that's true. The next slide, the next hospital was the Emmett House, which is this house over here. So the next thing to do was, well, let's put them in a private home, and we will contract for people to take care of them. So they came up with this idea. They put out this contract, and the lowest bid would get to take care of the patients. So they were transferred from the jail to the Emmett House, and Dr. Edwin Burr, the Irish physician, took care of them. And he provided both the indigent and prisoner care. And this worked out for about 4 years, when the second hospital was this one, which is this house that you're standing in right now. So Nurse Anna Scheper won this low bid contract for $1 a day. She would take care of the patients in this house, which she had just purchased for about $1,500. So she clearly had to get 1,500 patients through there to make her investment good. This house was at 11th and K. Originally it was over on State at Pantoja Park, but it had been moved to 11th and K. And she could take care of up to 19 patients there. So this is a list. Next. What? I changed it. Okay, maybe we'll come to it. Okay, just leave it. She could take care of up to 19 patients there. Well, I don't know how many of you walked through the house, but it's hard to imagine where you put the 19 patients. But she did. She did that for about 4 years, and then they were transferred to the Franklin House. Well, the problem with this $1 a day bid is that every year it got more competitive, and then the next year it's 90 cents, and the next year it's 65 cents, and then pretty soon they're contracting out how much they're going to pay the county physicians to go. And needless to say, as the amount went down, the problems with care went up, and it really became a travesty. Doctors were padding their bills. They were taking care of the same patient 3 and 4 times. But the Board of Supervisors got to keep the money that was left over. So finally the state figured this out, and they said, no more. You have to have a hospital. And that's when the county hospital was first built. And the county hospital, now we can go to the next slide. This is a postcard of the original county hospital. The contract was let out in 1980, and it is the county hospital in Poor Farm. 1880, yes. It was the county hospital in Poor Farm. That was its original proper name. And the whole point of the county hospital was to use these funds from the state to take care of indigent people who got off the boats who were sick, and patients in jail. It was in Mission Valley, below where UCSD is now. The patients, I mean, it's lovely, isn't it? The patients did the chores in the hospital, and it got to the point where there were patients that were indigent and not necessarily sick, but they would actually go there to work. And they actually had 4 acres of gardens and orchards, and they grew all their own food. So next slide. So this is the first report that was put out that described the state of the county hospital and Poor Farm, and it was put out in 1989. It was an article about this was published in the Journal of San Diego History, and it was edited by our own Mike Kelly, who was one of our family practice physicians at Kaiser. The hospital in 1889 had 25 to 48 patients in 60 beds. 8 were female, 222 were male. 2/3 were born outside the United States. And that goes back to this story about how this is the end of the road. They'd sort of arrived on one coast, they worked their way through, and they get here, and they really got nowhere to go. The major procedures done were amputations, drained abscesses, and removal of bladder stones. The most common cause of death was TB. So of the 21 patients who died there in that year, 5 had died of tuberculosis. Next slide. So the Grand Pacific Hotel is a beautiful Victorian hotel that's down on the corner of 5th and J. And we have a stack of downtown news articles. Sandy Wilhoit, our historian, wrote a beautiful article on the Grand Pacific Hotel this month in the Downtown News. And it was there as a hotel, but in 1901 it became the Helping Hands Mission. So there had been a Helping Hands Mission home and a Helping Hands restaurant on 8th and K, and they wanted to expand, so they expanded into the Grand Pacific Hotel. And that mission was started by a Miss Johnson, who had been a missionary in China, and she wanted an open door to aid the poor. Nice alliteration there. Then the superintendent, Mrs. Agnes Dodson, was the wife of a prominent businessman, and I love this quote. She instructed the county physician to send the sick and the indigent seeking relief. She didn't ask him, she didn't suggest it, she instructed him. So needless to say, they had plenty of work. Well, she ended up setting up a children's department there for sick, abused, abandoned, and orphaned children. They had a matron that was there all the time to take care of the children. The mission stayed there until 1907 when it ended up being moved somewhere else. But the children's unit stayed there till 1920. And in 1920, it became, the next stage was the Children's Memorial Hospital of San Diego, which was the forerunner of Rady Children's Hospital. So it started right here in the Gaslamp. There were also private hospitals. This is the first private hospital. It was on Columbian F. And Dr. Remondino, remember our circumcision guy? He was always a big promoter of a healthy climate. So he and Dr. Stockton, our ghost guy, got together and they opened a private hospital. And it had the best of everything, the most modern stuff. It had all kinds of baths and electricity treatments and all kinds of massages, and really promoted San Diego as a healthy climate. For some reason, it just didn't work out for him, and he ended up selling out to Dr. Stockton. He retired and he converted the old Santa Rosa Hotel into the St. James Hotel, which is in business today on 6th Avenue as a Ramada Inn. And he also had rooms there for people who are recovering, just because he thought they might be needed. So this hospital was closed in 1884, and then it became the Arlington Hotel. So that was actually most of its history, is the Arlington Hotel. There was a number. Next man was called J.A.P. Valclane, and he was thought to have been a TB patient here in the house. He actually owned the house for a short period of time after Anna Scheper sold it. And he left his city to the city of San Diego to start the first TB sanitarium. Now, TB was the major cause of death in the 19th century, from the beginning to the end. And remember, Pasteur and Lister didn't come in until you get towards the end of the 1800s. So TB, the answer to what the cause of TB was, didn't come until that late in the century. Nurses did their TB training in that hospital, so the Davis-Horton House has a connection to the first TB hospital also. Next. The next hospital is the Agnew Hospital and Sanitarium at 5th and Beach. It was started by a Dr. Gochenauer. And this has a soft spot in our heart because this is where Alonzo Horton died. It also had a surgery and maternity ward in addition to its baths and electrical treatments, and it closed in 1920. The next is Mercy Hospital. So the St. Joseph Sanitarium started, Mercy Hospital in its original derivation is the oldest hospital, the oldest private hospital in San Diego. And as you know, it's a private Catholic hospital, and it was started in 1881 as downtown as a five-bedroom dispensary. Then it was replaced by this 3-story structure that was in Hillcrest that was renamed St. Joseph's Hospital, and then In 1925, it was renamed Mercy Hospital when the hospital was built in Hillcrest. Next. So this is probably advice we all could use. So I love the concept that your teeth were hollow. So if you had hollow teeth, I can see where that would be a problem. So if you don't have any Florentine orris root, that actually is the European iris, and that is still sold today. Again, you can go to Amazon and they will tell you how to buy Florentine orris root. If that didn't do it, certainly that quart of spirits of wine or brandy would definitely help. And, or you could just rub them with a piece of rag dipped in vinegar. I don't know why they didn't just say that in the first place. It just seemed like that would have been a whole lot easier. All right. Next. Oh, nurses. So nursing, pre-Civil War, nurses worked in hospitals as untrained working class women of low status. Home nursing of unrelated patients was the next stage of nursing. And Anna Scheper falls into that category. She was the nurse that ran the hospital here. And we don't know how she was trained, if she had any specialty training at all. And we don't know why the county supervisors decided that they would have a nurse run this hospital instead of having a physician. But she fell into that style of nursing. So nurses were not allowed to take care of sick and wounded until actually after the Civil War. And the Civil War is a big turning point in terms of the nursing profession. And it became a professional service in the manner of Florence Nightingale at the end of the 19th century. The first nursing school in San Diego was in 1904, and it was at the county hospital and at the Agnew Sanitarium. And the nurses, so the original nurses were sisters, and that was in Europe, and they were like nuns. They were sisters. And the nurses, when they were first trained, were treated like nuns. I mean, they had hours, they had bed checks, they had rules of conduct. In the East Coast, nursing, the answer to about everything about how long it took for it to make it from the East Coast to the West Coast is about 30 years. So in 1904, so in the 1870s, there were nursing schools in the East Coast. As hospitals started taking in pediatric patients and OB patients, the next slide, nurses started developing specialized skills. These are nurses that are making formulas in hospitals. Formula was first established right at the turn of the century, although it didn't really formula didn't really become popular until World War II. But you can see how elaborate. This is half the slide. There's another half. I mean, this was a huge ordeal to make these formulas for infants. Okay? How to cure a toothache. Now, we could probably do most of this. The tricky part here is the hot funnel and creating the fume and directing it into the tooth. That might be a little bit tricky. Next. So physicians were your own druggists. Were their own druggists. So when we talk about a physician also having the drugstore, there's nothing unusual about that because the profession of druggist didn't actually exist. So you would basically concoct these medicines for yourself. You'd have to be able to order them from somewhere. You're probably ordering them from the East Coast. They're coming around the Horn all the way back up to San Diego. We didn't have a railroad here until 1885, so they couldn't have come across the country until that period of time. So you basically had the materials that you had with you. Next. Now, you didn't have to be a physician to use these drugs. So this little handbook on Be Your Own Physician that tells you all these things you can do on your own, you could go down and you could buy all those products from whoever you could find them from. There was nothing that said it had to be from a doctor. But if a doctor wanted to give a prescription, he would or she would have to make it on their own. And you could say anything about your medicine. You could say it cured anything, whatever you wanted. And most of the time, whatever it cured, it also caused. So, you know, it was one of those conundrums. Next.
Just cross out often sold by postmasters and just write, these medicines are sold by internet. It's still the same. It's exactly the same.
So these were in the 1890s. These were some very popular medications here. You could use cocaine for your toothache. Coca-Cola, we all know, had cocaine in it. Some of these others you can only imagine. Here's the Kickapoo Indian worm killer. That sounds like it would be very effective.
It was like alcohol, 40% alcohol.
Well, most of the medicines were tinctures of some sort of organic herbal product and alcohol. That was by far the most common, drug constituents of drugs. So marijuana was widely used for ailments along with heroin, cocaine, and opium, and morphine. All of them were legal. Morphine and opium, in its medical form laudanum, were extensively used in surgery along with alcohol, and not rubbing alcohol, drinking alcohol. And there's the Western version of that, the bullet, before ether was available in San Diego. So we don't know when ether arrived in San Diego. We know that Dr. Hoffman practiced here for over 20 years. So he got here in 1855, so that's 1875. We know that he read about a successful surgery in Europe in 1881. That wasn't in the United States. That wasn't Morton's surgery. So the next slide. So this photograph is for the surgery that was done by Thomas Morton in 1846. So he didn't know about that. So it was from 1846 in the United States till 1881 that he heard about ether being used for surgery in Europe. Now this is actually a very famous photograph. It's fake. There were two photographers that they arranged to get this operating room. This was a big deal. Everybody knew about this. First place, ether wasn't totally new. It had been used before, hadn't necessarily been published. So there were, it was a product that had been used in Europe, but everybody knew when this operation was going to happen. So they had two photographers there. Unfortunately, one of them had a very weak stomach. And so they're supposed to get this photo, and he just can't perform. They don't get the photo. So this is actually a reenactment of the surgery. So in addition, it was a tumor in the, I think it was a tumor in the thigh, in the inguinal area. So there were a few inorganic compounds that were available. The most favorite was mercury. And people would come, there were articles about people visiting San Diego and talk about how the people had just this very odd pallor and they just didn't look healthy, which was probably mercury poisoning. There were also medical devices that were used here. So one of them was maggots. So prior to the use of antibiotics, maggots were the most easy way to debride a wound, especially a wound like gangrene. And so they became very popular during the Civil War. And the other common medical device was bloodletting. So leeches there are centuries of history about the use of leeches in medicine. So these are specialized leeches. They're medical leeches, and they're Medicinalis, and they are fresh. They come in they're freshwater leeches from Europe. So it's not like you just order a bunch of leeches. Somebody has to have the leeches. They have to have aquariums. They have to maintain the leeches, and they have to get the leeches to you. So we assume that there were leeches here that were used during this period of time. They were popular until the end of the 19th century, and William Osler, the last medical textbook that he published, he's considered to be the father of modern medicine, and actually was probably the original designer of our medical education system as we now know it. He actually promoted leeches in his last book, which was in 1920. So he's believed in leeches, and not for any other purpose, not for tiny little microvascular, I mean just plain bloodletting, until the 1920s. So if you didn't have leeches, what could you do? So you could use a form of phlebotomy. This is actually a little kit which would cut the vein, and then you would just collect the blood. And there's supposedly only about 3 photographs that have ever been taken of this actual procedure, and this is one of them. And there wasn't any plans to use that blood. They weren't doing any tests on it. They were just simply removing the blood because they thought that was causing the illness. Okay, next. So electricity was a very popular modality, and it was thought that electrical force had curative properties. And there were sanitariums, like both the Agnew Sanitarium and the Dino Stockton Hospital, that used electricity that was monitored by physicians. I suppose that that is an improvement over some that aren't monitored by physicians. But this was a period where there were sanitariums literally all over the city. I mean, you could turn a corner and there'd be another sanitarium. And most of those sanitariums were not monitored by physicians. They were just healers who, purported to know how to use electricity, and there was no controls over it. But they had many fabulous treatments that they could give you. The next popular treatment was hydrotherapy. And this is Sebastian Neep, and he had a hospital. He was not a physician. He had a hospital in Bavaria, and it was famous for developing hydrotherapy. And the whole idea of hydrotherapy is getting a cold treatment and then getting a hot treatment. You could get that cold treatment and that hot treatment in many different ways. You could have baths, you could have vapor baths, you could have douches, you could have cold and warm packs, sometimes with herbs. But this became famous worldwide. And so here in San Diego, next slide, we had a gentleman named M.A. Lessam, who also was not a physician, but he came here and he said, this clinic is going to be exactly like the one in Bavaria. So he built his clinic with all these hydrotherapy treatments that were going to be really, really authentic. He was so successful, he ended up opening these clinics all through Mexico. It ended up spreading into Mexico after this period. Okay? So pediatricians are often accused of practicing veterinary medicine. So I'm going to take advantage of that and talk about just one more type of medical care in San Diego. So Dr. Henry Wegeforth was, as we all know, the founder of the San Diego Zoo. He went to medical school in Baltimore. His whole family was full of doctors. He actually literally ran away to the circus. I mean, when he was growing up, some circus came to town. He just thought it was so exciting. He ran away with them. One of his brothers went, brings him back, and he says, no, that's not what we do in this family. And so you go to medical school. So he goes to medical school, and he trained in Baltimore. After that wanderlust was not out of him, so he came out to Colorado. He got TB, and so when he was in medical school, so he came to Colorado, and he was a cowboy for a while, and he finally got healthy again. Goes back, then he trains in Johns Hopkins as a surgeon. So by the time he got to San Diego, he was an extremely well-trained surgeon. And his 2 brothers were physicians. One of them was a neurosurgeon, was one of the first neurosurgeons here in town. He came to San Diego in 1908, and he started a clinic in the Granger building. He married the owner of the building, who happened to be one of the richest men in San Diego. He had 2 mines in Colorado that had made him a very wealthy man. And after the 1915 Panama exhibition, he thought it would be great if San Diego had a zoo. So he bought the animals and he kept them. And then he went to a menagerie. There was a local menagerie, and that was sort of like an amusement park with animals. And he bought the animals there, and he put them all together, and that was the start of the San Diego Zoo. Well, before the zoo was really established, he was always fighting with the Board of Supervisors about not giving him enough money, and they would go back and forth, and he had directors coming in and coming out and coming in until he finally said, forget it, I'll run it myself. He kept baby animals in the basement of the Granger building. So you could say that both Children's Hospital and the San Diego Zoo started in the Gaslamp Quarter. So, in summary, medical care in 19th century San Diego was primitive compared to what was happening in Britain and Europe and on the East Coast. The new physicians who arrived in San Diego, however, were very well trained, but about half of them came because they were sick. One of their major functions was as public health physicians. They boarded ships to prevent diseased people from getting off the ship. They fighted epidemic scourges like smallpox, tuberculosis, and influenza that raced through the city. They promoted sanitary practices as they became known. And honestly, there are so many parallels to what's happening in this city right now compared to what was happening in 1875 that it's really scary. They were out of the loop with regard to new developments. They were usually about 30 years behind. But they were educated people, and when they found out about new theories and what to do, they put them quickly into practice. San Diego was also a mecca for those seeking a healthy climate. Many of them were the actual physicians that were here. That led to a lot of charlatans and a lot of ineffective treatments long after they'd been discredited elsewhere. But mostly thanks to the state and the pressure they put on the city to clean up a lot of those kinds of problems at the turn of the century, it actually became a very sophisticated medical community. And that's where we are in 1900. Now, we have some things to show you, and I thought that what we would do, we actually have a nice little collection in our hospital room, but it's always screened off, so you can't actually go into the room to see the instruments. So what I'd like to do is just show you what we have, and then when we get done, if you have questions, you can come over and look, and we can give you a little bit better idea. We have quite a few physicians here in the room. I'm sure some of them would be happy to explain some of these things. And then Ashley, our collections manager, is going to show you 2 items that we have that we're very, very proud of. So let me just come over here. I don't think so.
Okay.